All right, today we are going deep on a condition that has fascinated and frankly baffled people for centuries. Theologians, philosophers, scientists, you name it. Our guide for this journey is the Oxford Handbook of Obsessive-Compulsive and Related Disorders. We're going to trace the incredible story of how we think about OCD, from seeing it as some kind of spiritual test, all the way to understanding it as a matter of complex brain circuits. So let me ask you this. What happens when a thought just shows up in your head? It's not when you want, it's actually pretty distressing, and no matter what you do, you just can't shake it. That feeling right there is the core of what we're exploring today. But, how did we get from calling this a temptation from the devil to diagnosing it as a complex neuropsychiatric disorder? Well, that's the story we're about to unfold. So, here's the game plan. We'll start with what OCD means today, just to get our bearings. Then we're going to jump in our time machine and go all the way back to its religious origins. We'll make a pit stop with Freud, of course, then see how modern science completely changed the game. After that, we'll decode the official diagnostic manual, the DSM, and finally, see where OCD fits in the grand scheme of things today. Okay, before we dive into the past, we really need to know where we're standing right now. So let's lock in a clear, modern definition of OCD. This is going to be our anchor as we start navigating all the historical twists and turns. So at its core, modern OCD is built on two things. First, you've got obsessions. And we're not just talking about a song stuck in your head. These are sticky, intrusive thoughts that cause a ton of distress. And second, you've got compulsions. These are the repetitive behaviors or even mental routines you do to try and get rid of that distress. You can have one or you can have both. Okay, baseline set, let's get going. For a long time, there was no medical box to put this in. If you were tortured by intrusive thoughts, especially thoughts that were blasphemous or violent, it was seen as a spiritual problem. A literal battle for your soul. And check this out. This quote from St. Ignatius of Loyola back in the 1500s is one of the earliest accounts we have. He's describing what we now call scrupulosity, where OCD latches onto morality and sin. And he just nails the central feeling of the disorder with that last line. I doubt and do not doubt. That endless uncertainty is the core of it. Fast forward about a century, and you've got Bishop John Moore talking about religious melancholy, and he noticed something absolutely critical. He saw that the more people tried to fight these thoughts, to push them away, the stronger and more frequent they became. It's that classic don't think of a pink elephant problem. Today we call it the paradoxical effect of thought suppression. Now, the first real shift from the spiritual to the medical came from a French psychiatrist, Jean-Étienne Esquirol. He basically took the conversation out of the church and put it into the clinic. He called it partial insanity, and what he meant was totally revolutionary. He realized that unlike people with psychosis, these patients knew their fears were bizarre. They had insight, and this idea that you could be tormented by a thought that you yourself know was absurd was a massive breakthrough. And then came the age of psychoanalysis. The focus shifts yet again, moving away from the soul or even the body and diving deep into the mysteries of the unconscious mind. So you had two big thinkers with very different ideas. Pierre Janet thought it was basically a weakness of the nerves, like the mind was just too tired to push these thoughts away. But Sigmund Freud, he had a much spicier take. He called it compulsive neurosis and claimed these obsessions were really just disguised guilt or memories, usually about repressed childhood sexuality bubbling up from the unconscious. Freud's most famous case to prove his point was the rat man. This poor guy was tormented by a truly horrific obsessive thought about rats. But for Freud, this wasn't just some random brain glitch. Oh no, he saw it as a complex symbol of the patient's repressed mix of love and hate for his own father. And for better or for worse, theories like this pretty much dominated the conversation for the next half a century. Then, around the middle of the 20th century, everything changed. Again, we started to move away from the analyst's couch and into the science lab. New technologies, new theories, they gave us a completely different way to look at OCD. Today's understanding really rests on three main ideas. First, the biological model. We can literally use brain scans to see that certain brain circuits are in overdrive, like a worry circuit that's stuck in an on loop. Then there's the behavioral model, which shows how compulsions create a vicious cycle. They give you relief for a minute, but in the long run, they just make the fear stronger. And finally, the cognitive model, which looks at faulty beliefs, like thinking that having a bad thought is just as bad as doing it. So, with all these new ideas flying around, how did they get, standardized? For that, we've got to look at psychiatry's official handbook, the Diagnostic and Statistical Manual of Mental Disorders, or the DSM. And tracking OCD through the different versions of the DSM is like watching science figure things out in real time. It's quite a ride. In 1952, it was just a reaction to something in your life. By 68, it was a neurosis, and they officially added anxiety and distress to the description. But the real game changer was 1980. It becomes a full-blown disorder. And for the first time, the book actually explains why people do compulsions. And then, in the latest version, they even dropped the requirement that a person has to know their thoughts are irrational. Let's just pause on that 1980 change for a second, because it was huge. The DSM-3 was the first to officially say that compulsions are not random tics. They have a purpose. They're a deliberate, even if illogical, attempt to control the obsession and stop something bad from happening. This one idea became the absolute bedrock of modern therapy for OCD. And that brings us to the most recent big update in the DSM-5. Remember how Esquirol said that insight was the key feature? Well, we now know that's not always true. For some people with really severe OCD, they can lose that insight and become totally convinced their fears are real. So the diagnosis now reflects that. It allows doctors to specify the level of insight, all the way from good to absent or delusional. And this brings us to the last and maybe the most important change in how we see OCD today. And it's all about one question. Where does it belong? For decades, the answer was simple. It's an anxiety disorder. Well, not anymore. Yep. In 2013, with the DSM-5, OCD was officially moved out of the anxiety disorders chapter. It was given its own brand new home. This was a massive shift. It was the scientific community basically saying, you know what? The core engine driving OCD is different from what's driving things like panic attacks or social anxiety. So this new chapter is called Obsessive-Compulsive and Related Disorders, and it groups OCD with other conditions that share those core features of repetitive behaviors and intrusive thoughts. So its new family includes body dysmorphic disorder, hoarding disorder, and things like hair pulling and skin picking disorders. It's official, they are all now understood to be on the same spectrum. So what does this whole journey tell us, right? Going from demonic possession all the way to faulty brain circuits. It shows that our definition of a mental disorder isn't set in stone. It's a story that's constantly being rewritten by culture, by religion, and by science. Each stop on our journey, from the priest's confessional to Freud's couch to the fMRI machine, gave us a new way to talk about a very deep kind of human suffering. So the real question isn't just what we'll discover next, but how those future discoveries will continue to change the very meaning of the mind itself.